You have the three level of governances broadly. So you have the central ministry, you have the state ministry, and you have the district sites. Okay, the central ministry, as you know, it is located in Delhi. It is located in Nirman Bhavan in Delhi. The ministry is located there. Under that, there is the national divisions of, so there is the national headquarters of NHM, and you have the national divisions of each and every health program. You have the ministry of the directorate, you have all of that. Below that, at the level of the state, again, you have a similar, health is mostly a concurrent subject. So both the center and the state have responsibility in health, but there are certain aspects of health where it is solely a state responsibility, and there are certain aspects of health where it is both a central and the state responsibility. Okay, so going ahead, we will look at those things as well. So just like you have the ministry, the directorate, and the divisions in the central level, you also have a similar structure at the state level. You have the Department of Health and Family Welfare. So at the central level, it is known as the Ministry of Health and Family Welfare. And so ministry is the part where you have the ministers of state, and the IAS officers there will be there. Then you have the Directorate General of Health Services. So there you have the health officers, the officer cadres who take care the administrative cadre of health in India, who take care of the administration, and you have the Central Council of Health and Family Welfare who take the decisions regarding the policy aspects of how to decide on what policy decisions will be taken for this country. Okay, you also have some bodies like you have the NHSRC, you have the National Health NHSRC, Health Systems Resource Center. You have the NIHFW, you have the National Institute of Health and Family Welfare. You have the NCDC, the National Center for Disease Control. Okay. So you have all of these, but these are all adjunct institutions that will that report to the Directorate General of Health Services and contribute whenever they're required. Okay. At the state level, so just a second, I will erase this. So at the state level, you have the State Ministry of Health, and you have also the State Health Directorate. So just like you have the Central Ministry of Health and the Central Directorate, you also have the State Ministry of Health and the State Directorate. So along with that, just a second, I will pointer options. Okay. So at the state level also, you'll have the State Ministry of Health and the State Health Directorate. And at the district level, what you will have is at the district level, you'll have the office of the CMOH, the Chief Medical Officer of Health. So in some parts, the district level officer is known as the CMOH or the Chief Medical Officer of Health. In some parts, the CMOH is also known as the civil surgeon. Okay. There's some parts known as the civil surgeon. In West Bengal, is known as the Chief Medical Officer of Health. Okay. So this is like the directorate. Okay. So like you have the directorate at the level of the state, the CMOH or the civil surgeon is like that. And just like you have the Ministry of Health at the center and the state level, at the district level, you have the highest body of the Panchayati Raj institution, which is the Zilla Parishad. Okay. So we will come to this in detail. The district level health administration we will discuss in detail. But before that, just I want you to understand that there will be a central level ministry, a state level ministry, and district level is mostly they are responsible for implementation. Okay, so here you do not need a lot of policy formulation or decision on what to do, how to do. Okay, they are mostly told what to do and they have to implement what. Okay, the central, it will give the overview of what are the targets that need to be achieved, what are the goals that we achieve, those are outlined by the center. Based on those targets and goals, the state does is it looks at what are the problems at the level of the state. And the state will develop specific action plans, specific ways that the state can function, state can act in order to achieve the central aims and goals. And once it formulates its action plans, it communicates to the districts, where the district offices, they are mainly responsible for implementing those state plans at the districts to ensure that the national goals are achieved. Okay, so that is broadly how the healthcare delivery system in India functions. So